next bone, that is the humerus. So this is the longest bone of your upper limb. Okay, it is not longest bone of the body. It is on the longest bone of the upper limb only. Okay, longest bone is femur. Okay, so humerus, this is the long bone of the or longest bone of the upper limb, and it is the type of bone. This is the long bone only. And see, this is the bone of arm. So this is the arm region. So you will find the humerus here, in the both sides. So two humerus will be there. Are you getting? So it is the long bone and the long bone of the or longest bone of the upper limb. Okay, and the location it lies in the arm region. So that is the bone of the arm region. That is the introduction and the location. Now see, if you see the humerus bone, so we can read the humerus bone under the three headings. So first we will read the upper end, next is the shaft and the lower end. Now see here. So this portion. So this is the upper end, and this portion, this is the lower end, and the middle prism-like structure. Okay, so this is the shaft. So now this is the shaft. So we'll read under this three heading. Okay, so we'll read the features in the upper end, we'll read the features in the shaft, and we'll read the features in the lower end. Mostly for the long bone, okay, most of the long bone we'll read under this heading, upper end, shaft and lower end. Okay, most of the bone. So humerus will read like this, so radius ulna will read like this, even tibia fibula will read like this, and even the femur bone also will read like this. Okay, most of the long bone will read under this heading, upper end, lower end and shaft. So this is the upper end, this is the lower end, this is the shaft. Now we can see in this diagram here, this highlighted color, red color, so this is the humerus bone. So that is the bone of the, let's go for the upper end first. Now see here, in the upper end you will see the various structure, or you will see the various features. So in the upper end you will see the head, you will see neck, you will see the tubercle, you will see the groove you will see. Okay, these features you will see. Now what are these features we have to see now? See, and the head. So this head, can you see this head is the articular surface? Can you see this smooth portion here? Are you seeing? Is it visible to you? So this is the
Yes,
head.
sir. Yes.
So this is smooth portion. So that forms the 1/3 of the sphere. Okay, it's like sphere-like, but not complete sphere. The 1/3 part of the sphere. It represents the 1/3 part of the sphere. Okay, so that is the head. One-third part of the sphere. So now see, it is the articular surface. Okay, articular means it helps in formation of joint. Okay, so it forms the ball. It forms the ball. See, so this surface is articular. Now this ball, it forms the ball. So the joint formed by this head of the humerus and the socket of the glenoid cavity of the scapula. So that is the glenohumeral joint. So humerus, the head of humerus forms the ball, and the glenoid cavity forms the socket. So the type of joint is the ball and socket joint. Okay, so the ball, okay, of the that is the shoulder joint only. Okay, are you getting? So this is the like ball, isn't it? So let's go for the previous picture. So this is like socket. So the ball, see, this is the glenoid cavity. It is not like cavities. So head is here. So head will be here. So ball and socket joint. Now see, if you compare the size of the glenoid cavity and the head of the humerus, relatively the head of humerus is larger. Okay, so suppose this is here is the socket, isn't it? Let me show here. Okay. Okay, now see, can you see this socket here? So this is the glenoid cavity that forms the socket, whereas the head of humerus forms the ball. So they will together form the ball and socket joint. Okay, now see here, if you see the head of humerus, it will be much more larger than the socket. Socket is this much, but the head will be like this. It will be large enough. Okay, it will be large. So the head, it will not fit in the glenoid cavity. So it will be larger here. Okay, head will be more larger than the socket. Okay, so if it is the socket, now head will be larger here. Okay, so this socket cannot accommodate the head because of large size. So we need the secondary socket. So the secondary sockets, they are formed by this. So see here, acromion is there, coracoid process is there. So there is the extension of one ligament, acromion. So one ligament will extend here. Now see, this forms one socket-like structure. So that will accommodate the head now. Okay, because due to the large size of the head, we need the secondary socket. So the secondary socket is formed by the acromion, coracoacromial arch. So this ligament is the coracoacromial ligament. This is the coracoid process. This is the acromion. While reading the shoulder joint, I will tell this thing. So relatively, the size of the head is larger than the socket formed by the glenoid cavity of the scapula. Just you remember this thing. So this is about the head. So the head is the articular. So it forms the 1/3 part of the sphere. Okay, and forms the ball, and forms the head, ball and socket joint with the glenoid cavity of the scapula. Now see, if you see the orientation of the head is directed, it is directed medially, upward and slightly backward. Okay, the head is directed medially. Okay, so it is directed upward, medially, and backward. Okay, so head is directed medially, upward, and backward, whereas the glenoid cavity is directed laterally, forward, and slightly upward. Okay, so this is the orientation of the head. So head is not like straight. So suppose this is the humerus. So this is the head. Now this head, so this head is directed. It is not directed totally laterally. Okay, so it is directed. So it is not directed totally medially. It is directed medially, somewhat upward and slightly posteriorly. Okay, but you remember this is the orientation of the head. So now next feature in the upper end, that is the neck. So neck, we have got two type of neck here. And next is the surgical neck. So this anatomical neck, so you can differentiate the anatomical neck easily here. See here. So see, this is the smooth articular head, isn't it? Can you see this margin here? So that separates the head from the rest of the upper end. So can you see this? So this is the neck. So this is the neck only here. Okay. So this is the neck. Anatomical neck is here. So that separates the head from the rest of the upper end. See, this whole thing is the upper end, isn't it? This whole thing is the upper end. Okay. So the head, this anatomical neck separates the head from the rest of the upper end. So that is the anatomical neck. Whereas the surgical neck, that is NECK only, okay, not E. So the surgical neck, that is the narrowest part of the upper end, which separate the upper end, which separate the whole upper end from the shaft. Okay, almost somewhere here will be your surgical neck. So this part will be your surgical neck. Okay, so this part will be the surgical neck. Just above this is the upper end. So just below that is the shaft. Okay, so this is about the neck. So the anatomical neck separates the head from the upper end. So head from the rest of the upper end, whereas the surgical neck separates the so this is the narrowest part, okay, constriction, okay, that separates the shaft from the lower end, sorry, shaft from the upper end, that is the surgical neck. So that is the surgical neck, whereas the head, so that means actually this anatomical neck separates the articular surface from the non-articular surface. Okay, just remember this thing. That is the neck. Next features in the upper end you will find, that is the tubercle. Tubercles. So here you will find the two tubercles. So that is the greater and the lesser tubercle. Then you will find the groove. So the groove you will find here, that is the intertubercular groove or sulcus. Groove or so now see here. So tubercle. Can you see this two bony prominence in the upper end? Just I will highlight that. So can you see this prominence here?
Yes, sir.
Okay, let me draw here. Can you see this bony prominence here? So one is here and one is here. Can you see this two bony prominence here?
Yes, sir.
So they are the tubercle. So terminology you already know. What do you mean by tubercle? So they are the irregular bony prominence. Okay, so this is the tubercle. So the other two tubercle. So the lesser tubercle, so it faces anteriorly. In the anatomical position, the lesser tubercle it faces anteriorly, whereas the greater tubercle it faces laterally. This you have to remember. So the larger one is the greater tubercle, the smaller one is the lesser tubercle. So the lesser tubercle, so it faces anteriorly, whereas the greater tubercle it faces laterally. Okay. Now see, in between the two tubercle, you will find some depressed part, isn't it? So depression you can see, group-like structure you can see, isn't it? So this depression, so this is the intertubercular sulcus or groove. So in between the two, so intertubercular groove or the sulcus. The name of this groove, so that is the next name for this groove or sulcus, that is the bicipital groove. Or bicipital sulcus. Same thing, sulcus and groove. Okay. So the bicipital groove or intertubercular sulcus, same thing. Okay. So that is the depressed region between the two tubercles, that is the intertubercular sulcus or bicipital groove or sulcus, same thing. So this tubercle or this sulcus, it has got two lips. So medial lip, it has got a lateral lip, and it has got a floor. Okay. And it has got a floor. So lips, they forms the margin, whereas the floor, that is the base. Now see here. So if you see this groove, okay, so three features in the groove, you will see the medial lip, lateral lip, and the floor. Now see here, I'll draw here. Now can you see here? So can you see this margin here?
Yes, sir.
Let me draw it. Okay. So can you see this margin here? So this is the one margin of the groove. So next margin is somewhere here. Okay. Okay. So this is the floor. Now see, so this is the lateral lip and this is the medial lip. So the lateral lip, so that is formed by the greater tubercle. This is not tuberosity, tubercle. Okay. So greater tubercle. So greater tubercle forms the lateral lip, whereas the medial lip is formed by the lesser tubercle, and this medial lip it continue as the medial border of the shaft. This lateral lip it continue as the anterior border of the shaft. Okay, while reading the shaft, it will come to know. You will come to know. So this medial lip, so it continue with the medial border of the shaft, whereas the lateral lip it continue with the anterior border of the shaft. Okay, just you remember this thing. So in between the two lips, this part, this is the floor. Okay, floor. So now see here. So this floor of the bicipital groove, it continue with the anterior medial surface of the shaft. Okay, so anterior medial surface of the shaft that lies between the anterior border and the medial border. So this is the anterior medial surface now. So this surface, it will continue with the floor of bicipital groove in the upper part. Okay, just remember this thing. So this is the lip two lips. So because see, while reading the muscle attachment, so the lip of the floor, the lip of the group has got a different muscle attachment of different muscle. In the lateral lip, there is the different muscle is attached. In the medial lip, different muscle is attached. In the floor, there is the attachment of different muscle. Okay. So thus you remember the part. So it will be easy to remember the muscle attachment. Okay. This is about the group, and this is about the, so this is the lesser tubercle and this is the greater tubercle. Okay, and some more features are there in the greater tubercle. Okay, now if you see the greater tubercle, so this greater tubercle, it has got a three impression in the upper part. Okay, so the three impression, so that is the upper, middle and the lower impression. Just you remember this thing. So the greater tubercle in the upper part, it has got a three impressions. So they are the upper, middle and the lower impression. So this impression is important, okay, while reading the muscle attachment again. So in this three impression, so three impression in the upper part you will find upper impression, middle impression and the lower impression. So here you can see here this region, so lower impression, middle impression, upper. So in this all impression there you will find the different muscles. In the upper impression you will find the insertion of the supraspinatus, in the middle impression infraspinatus, in the lower impression you will find the insertion of the teres minor muscle. Okay, thus you have to remember this part now. Okay, it will be helpful in reading the muscle attachment. Are you getting? Greater tubercle. So that is
Yes, sir.
the
Yes, sir.
bony prominence on the lateral side of the upper end, and then it bears the three impression in the upper part, that is the upper, middle and the lower impression. So lesser tubercle, that is the bony prominence on the anterior side of the upper end, and it faces anteriorly. So that is the lesser tubercle. In between the two tubercle, that is the intertubercular sulcus or bicipital sulcus. The bicipital sulcus, it has got a two lip, middle lip and the lateral lip. In between the two lip, that is the floor of the bicipital group. So that is about the upper end. Now we'll go for the shaft. So that is the middle portion. Okay, it has got a like triangular prism like structure. So it has got a three borders and the three surfaces. So prismoid shape. Okay, shaft has got a prismoid shape. Shaft. Now see, this shaft head has got a three borders and the three surfaces. And the three surfaces. Now what are the three borders you have to know. So the three borders, they are the anterior, medial and lateral. It is easy. Okay. Anterior border, medial border and lateral border. Anterior border, medial border and the anterior border, medial border and the lateral border. Just you write border here, okay? Then the surfaces you will find here. So anterior, medial surface, lateral surface, anterior lateral surface. Okay, then next is the, now we'll see this thing. So these are the surfaces. Okay, now let us see first border, then surface will be easy. Okay. Okay, now see, I'll draw with the black color now. Now see here, first I'll draw the border, okay. Now see here, so here is the lateral lip of the bicipital group. Here is the lateral lip, sorry, medial lip of the bicipital group, okay. So this lip, it will continue with the medial border, then in the lower part, so it forms the medial supracondylar ridge. Okay, now see here. Now next is here. So this is the lateral border of the bicipital group. So that continue with the anterior border of the shaft. Now the next border here is the lateral border. So this lateral border, so it begins from the posterior aspect of the, okay, now goes to the posterior aspect. Now somewhere from here. So here is the lateral border. Okay, some part of the lateral border is here. So now it will go behind this greater tuberosity. Okay, so these are the three borders. Now see, and so see the anterior border first. Now see, if you see the anterior border, so it begins from the lateral lip of the bicipital groove. Okay, then it move downward. Okay, so then it will terminate. Okay, now see this is the anterior border. So beginning is from that is the continuation of the lateral lip of the bicipital groove. Okay, so this is rounded border. So we are seeing the border. So this is the anterior border. So it begins, or that is the continuation of the lateral lip of the bicipital groove. Okay, and this is the rounded border. Okay, so this is the anterior border. Then the next see here, this is the medial border. So the medial border, so beginning that is from the medial lip of the bicipital groove. Okay, so it is the continuation of the medial lip of the bicipital groove. In the lower part, see the medial border, so it forms the medial supracondylar ridge. Okay, continue with the medial supracondylar ridge of the lower end of the humerus. So this border, this medial supracondylar ridge, that is the prominent ridge. Okay, so that is the medial supracondylar ridge. So the medial border in the upper part forms the medial border of medial lip of the bicipital groove. In the lower end, it continues with the medial supracondylar ridge. Similarly, the lateral border, so it begins from the posterior aspect of the greater tubercle. Okay, then it forms the lateral supracondylar ridge in the lower part. Okay, so you have to remember this thing. So anterior border, lateral border, medial border. So the anterior border beginning is from the posterior aspect of the greater tubercle. Okay, so that is the anterior border. Then in the lower part, it forms so it will disappear. See here, so it will disappear in the lower part. Okay. Okay, so this is the anterior. So the lateral, sorry, this is not anterior. This is anterior. It does not begin from the posterior aspect. So it begins from the lateral lip of bicipital groove. Okay, and disappear inferiorly. Okay, that is the anterior. The lateral will begin from the posterior aspect. So it begins from the aspect of the greater tubercle. Okay, and in the lower part forms the lateral condylar supracondylar ridge. So that is the, you can see this prominent margin in the lower part. So this is the lateral supracondylar ridge. Then the next medial border, so it begins from the lesser tubercle, or begin from the medial lip of the bicipital groove, or continuation of the medial lip of the bicipital groove. Bicipital groove in the lower part forms the medial condylar, supracondylar ridge. So that is about the border. So this is the medial supracondylar ridge. So this is the lateral supracondylar ridge. So that is formed by the medial and the lateral border. Okay. So this is about the border. Now surfaces, see. So three border is there. Now three surfaces. Now see. See here, so one surface is this surface, so next surface is this surface, and next is behind. Okay, just behind this. So three surfaces, they are the anterior, medial, lateral, and the posterior surface. These are the three surfaces. So this is the anterior medial surface. So this surface lies between the medial border and the anterior border. So this is whole surface. This is the anterior medial surface. And next is the anterior lateral surface. The surface lies between the anterior and the lateral border. So this is the anterior lateral surface. Similarly, posterior surface is there just behind the posterior surface. So you see that this is the posterior surface. So this posterior surface, so it is more clear here. So this is the posterior surface. So in the posterior surface is lie between the medial and the lateral border. So here you can see the medial border and this is the lateral border. This whole surface, this is the posterior surface. Okay, so these are the surfaces. So anterior lateral between the anterior and medial border, anterior lateral that is between the anterior and lateral border, anterior medial that is between the anterior and the medial border, posterior is between the medial and the lateral border. Just you remember this thing. Now see, anterior medial border in the upper part, it forms the floor of the bicipital groove. Just you have to remember this point. So the anterior medial surface, so the upper part or upper part continue with the, you can write upper part continue with the floor of the bicipital groove. Okay, you know this thing, bicipital groove. So it is continue with the, see, anterior medial surface. Okay, now next, if you see the anterior lateral surface, okay, so in the anterior lateral surface you will find the one tuberosity. So in the middle part of the anterior lateral surface you will find the deltoid tuberosity. So this is like U-shaped tuberosity, okay, present in the anterior lateral surface. Okay, somewhere here will be there. So that is the U-shaped bony prominence you will be here. So that is the deltoid tuberosity. Okay, just remember this thing. So this anterior border that forms the margin of the deltoid tuberosity also. Okay, so in the anterior lateral surface, in the middle part, you will see the U-shaped bony prominence, that is the deltoid tuberosity. In this tuberosity there is the insertion of deltoid muscles. Okay. Now in the posterior surface, so you will see the two features here. So in the middle part you will see the oblique ridge and the spiral or radial groove. So see here, you can see here the radial groove. So that is the groove for the radial artery and the radial nerve. Okay, there will be a depression is there. So that is the groove. So linear depression is there. So that is the radial groove. And just above the groove there is the oblique line is there. So in that line the bony surface is irregular there. That forms like a ridge, give like the ridge-like appearance. So that is the oblique ridge. So oblique ridge lies on the posterior surface. Similarly, spiral or radial groove lies in the posterior surface. Thus above the oblique, above the spiral or the radial groove, there is the oblique ridge. Okay, so in the oblique ridge there is the attachment of the origin of the one muscle is there, that is the triceps muscle is there, going to take the origin from that ridge. Okay, while reading the muscle attachment you will got to know about that thing. So these are the features you will see in the shaft. So don't forget the deltoid tuberosity, oblique ridge, spiral or the radial groove. Okay, on the posterior surface. Deltoid tuberosity in the anterior lateral. Okay. Okay, up to here. Now we'll go for the lower end. So in the lower end, so we'll see these features here. So that is the articular surfaces or articular part. So the lower end we'll see this thing. So this lower end is flat end actually. Anterior posteriorly it is flat end and it is expanded side to side. Okay. So just you take some soft or balloon and feel the ear and just you press anterior posteriorly. Then what will happen? They will flatten, isn't it? They will flat on the anterior posterior aspect, but expanded in the sidewise. So it is like that. The lower end is flat and anterior posterior. It is flat, but it is expanded side to side. Okay. So now in the lower end you will see this thing. So articular part you will see here and the non. So here, so this, can you see this smooth part here? So this smooth part here, so that is the articular part. So this articular part is formed by the capitulum and the trochlea. Capitulum and trochlea. Then the non-articular part, you will see the various thing here. So you will see the rays. Okay, so you will see the fossa and you will see the epicondyle. Okay, so rays you will see that is the supracondylar rays. Just I will write here supracondylar rays. Supracondylar rays, so two are there. So medial and lateral. The fossa, you see the three fossa here: radial fossa, coronate fossa, and olecranon fossa. Epicondyle, again you will see the two epicondyle, medial epicondyle and lateral epicondyle. So these features you will see in the lower end. Now see this articular part, so that helps in formation of the joint. So this capitulum and the trochlea you will see. Okay, non-articular part, they are not forming the joint. Okay, so they are the rough part only. So this, so supracondylar is you will see, radial, that is fossa you will see. So then the next is the epicondyle you will see. Now see here. So let's go for the articular part. Now can you see this smooth part here? So this smooth part, it is articular part and it helps in formation of this elbow joint. So see here in the smooth articular part also you will find the two features. So can you see this round head like structure? So this is the head. So that is the capitulum. And can you see this pulley like structure? You have seen the pulley, isn't it? Like it's the simple machine. It has got a two elevated margin is there and in between there is the groove is there, isn't it? It is like this. See these two margin are elevated, in the between groove is there. So it is like pulley like. So this pulley like articular part, that is the trochlea. So this trochlea articulate with the trochlear notch of ulna, whereas the capitulum articulate with the articulum with the head of the radius. Okay, thus you remember. So laterally there is the capitulum, medially there is the trochlea. Are you getting? So the capitulum, it is rounded, okay, rounded articular surface on the lateral aspect of the lower end, okay, which articulate with the head of the radius, okay. Next is the pulley shape articular surface on the lateral, on the medial side of the lower end, so that articulate with the trochlear notch of the ulna, that is the trochlea. The shape is like pulley. Now if you see the two margin or the edge of this trochlea, see, this is the lateral edge. See, this is the medial edge, isn't it? So the medial edge, it is slightly extending below. Okay. So the medial edge extends 6 mm below than the lateral edge. Just you remember this thing, because one terminology will come here, the carrying angle. So the medial edge of the trochlea, medial flank or edge, lies 6 mm below. Means it extends 6 mm below. Okay. So see, lateral edge is up, but the medial edge is below, isn't it? So it extends 6 mm below than the lateral edge. So just you have to remember this. So medial flank or edge of the trochlea lies or extends 6 mm below. Okay, below the. So that results the So just remember this carrying angle, okay? After explaining all the part, I will explain the carrying angle, okay? Are you getting clear? Now next is the non-articular part. Now you can see this fossa here, the depression here. So these are the depression. So in the anterior aspect, you will find the two depression. In the posterior aspect, you will find the one depression. So the depression just in the anterior aspect, just above the capitulum, the fossa, that is the radial fossa. The depression is radial fossa. Just above the trochlea, the fossa, that is the coronoid fossa. Okay, and that these two are in the anterior aspect. In the posterior aspect, you will find one depression, that fossa just above the trochlea, that is the olecranon fossa. Just remember the name of this fossa. So see what will happen. See, so this radial fossa, it will accommodate the. This is the anterior aspect. So the radial fossa, it accommodates the circumference of the head of the radius during this flexion movement. Similarly, the coronoid fossa, it accommodates the coronoid process of the ulna during the flexion of the elbow joint. The olecranon fossa, so it will accommodate the olecranon process of the ulna during extension. So the circumference of the radial head will be fitted here during the flexion of the elbow joint. Similarly, the coronoid process of the ulna will fit in that fossa during flexion. The olecranon process of ulna will fit in that fossa during extension of the elbow joint. So this is the extension. During extension, the olecranon process will fit here. Okay, just remember this thing. So these are the fossa. So next is the epicondyle. Now we can see the two bony prominence on the either side in the lower end. So the most prominent bony prominence, that is the medial epicondyle. So that is subcutaneous. You can feel that epicondyle by touching by your hand also. So it's the most prominent. So just behind the medial epicondyle, there is the groove. In that, through that groove only, there is the ulnar nerve will pass. Okay, ulnar nerve will pass behind the medial epicondyle. So sometimes while sitting in the bench, sometimes you may hit your elbow in the wall or somewhere and you will feel like some electric shock, like, isn't it? So that is due to the compression of the ulnar nerve. Okay. Then the lateral epicondyle, so it is not so much prominent. Okay, so this is the lateral epicondyle. Are you there?
Yes, sir.
Okay. So now the one terminology, that is the carrying angle.
Excuse me, sir.
Yes.
This much not today, sir.
Okay then. So yesterday I have already explained you that the medial edge of the trochlea, so it lies 6 mm below than the lateral edge, isn't it? So due to this, so now if you see the transverse axis along the lower end, okay, so the transverse axis is directed downward and medially. Okay, the transverse axis of the lower end of the humerus is directed downward and medially. Now see here, it is like this. Let me draw one transverse axis along your. Okay, now it will be like this. See, this is the transverse axis. Okay, so see the direction of the axis. See, so it is directed. So this is the medial side. Okay, and this is the lateral side. In this hand, it is like this. So the transverse axis is directed downward and medially. So this is the medial side in the, okay. So this is the medial side. Now see here. So this is the medial. For this bone, this is the medial side. Okay. So this is the medial side. For this bone, this is the medial side. Okay. So because see, this is the medial epicondyle is this. So medial epicondyle is this. So now if you see the axis, see the transverse axis in the lower end is directed downward and medially. So why this is so? Because see, this is the medial edge of the trochlea. See this medial edge. So this is the lateral edge of the trochlea. This is the medial edge. So this medial edge is extended below, almost 6 mm below than the. See here. So you already know that, see this medial edge of the trochlea, that is extend 6 mm below than the lateral edge. Okay, so due to that, the transverse axis of the lower end of humerus is directed downward and medially. Okay, that results the carrying angle actually. Now see here, just I saw in this picture, the previous picture. Now see here. Okay. See here. Now carrying angle I saw here. If you see, so this is the long axis of the arm, and this is the long axis of the forearm. Actually, the long axis of arm and long axis of the forearm, they does not lie in same line. Okay. So see here. Just I will draw the two axes now here. So if you see the long axis of the arm, okay, so it will be like this. So this is your long axis of the arm. Okay, if you draw the long axis of the forearm, so long axis of the forearm will be like this, isn't it? So can you see the angle between the long axis of the arm and the forearm? Can you see this angle? So this is the carrying angle only. So this angle, so that is the carrying angle. Okay, so in the anatomical position, okay, when your arm or your forearm is in the supine position, okay, and in anatomical position, what will happen? The long axis of the arm make an angle with the long axis of the forearm. That angle, that is almost 163 degree. So this angle, that is the carrying angle. Are you getting? So that is the carrying angle. Now this carrying angle, it will disappear when you do the pronation. So if you do the pronation of your hand, see the long axis of the arm lies with the in same line with the long axis of the forearm. But when you do the supination of your forearm, then what will happen? The long axis of the arm make an angle with the long axis of the forearm. That angle, that is the carrying angle. Are you getting?
Yes, sir.
Can you see this? So this is the anatomical position only, like this position, isn't it? So see, this palm is facing forward, isn't it? So now see, so this is your arm. So if you draw the long axis of your arm and the long axis of the forearm, these two axes make an angle that is 163 degree. That is carrying angle. Just remember this thing. Now, if you do the pronation of your forearm, okay, pronation, you know the supination. So this is the supination and this is the pronation. Okay, if you in the supine position, the long axis of the arm and the long axis of forearm, they does not lie in same line, so they make an angle. Okay, so that is carrying angle. But if you do the pronation, the carrying angle will disappear. So what will happen? See, now the long axis of your arm and long axis of forearm, they lie in same line, so there is no angle. Okay, so this is just, you remember, this is the carrying angle. Okay, so this carrying angle, so it will be more in case of female because of wider pelvis. Okay, so in female the pelvis is, this pelvis is wider, so this carrying angle will be more in case of female than in male. Just you have to remember this thing. Okay, are you getting?
Yes, sir.
Okay, so carrying angle is more in case of female because of wider pelvis. Because see, due to this carrying angle, if you carry the bucket, so you are not going to hit your pelvis. Okay, if this angle is not there, means what will happen? So you may hit your pelvis. Okay, so due to this carrying angle, so while carrying the bucket and something holding in your hand, you are not hitting your pelvis. Okay, so this carrying angle has to reduce this hitting. Okay. Thus, you remember this angle is more in case of female because of wider pelvis. Huh?
Sir, does it exist in all parts of the body, or
But
this carrying angle exists in all part of the body,
carrying
or
angle is for this joint only. This is for here only.
okay, sir.
This is for this elbow joint only. Here.
Okay, sir.
This angle is carrying angle. For the here only carrying angle. In case of lower limb, name will be different. Okay. But there is no carrying angle in lower limb. Here for this joint only, that is the name carrying angle. So the angle is 165 degree average. Okay, just you remember this. So it will be more in case of female than in male. Now that is the carrying angle. Okay. So now the lower end is over, isn't it? So all the features of the bone is over. Now we'll go for the muscle attachment of the humerus. Now see, these are the muscle. They are attached on the humerus. Okay, can you see the blue color and the red color? So this always remember in the diagram, if they give the blue color, that is the insertion of the muscle. If the red color is there, that is the origin of the muscle. Okay. Now we'll see this. So for the ligament and the capsule, there will be the green color. Okay, here is not given, I will tell that. Now see. Okay, now I'll list the muscle attached on the humerus. Now you can see this blue color muscle, isn't it? So we'll see the muscle attachment. Okay, now see, in the greater tubercle, so you will find the three muscle that is inserting into the greater tubercle. So while it in the greater tubercle, okay, the superior surface or the upper surface of the greater tubercle, it has got a three impression, that is the upper, middle and the lower impression. So upper impression has got a one muscle, middle impression has got a one muscle, and the lower impression one more muscle is there. Okay, in upper impression, so next is the middle impression, next is the lower impression. So now in the upper impression, so in these three impression, three different muscle are inserted here. Okay, so that is the greater tubercle only. Now you see this this is the greater tubercle. Okay, this is the greater tubercle. Here you can see only one impression here. The next impression just behind, next impression below. So next is here, next is here. So these are three muscles now. One, two, three. Upper impression, in the upper impression one, middle impression one, and the lower impression one more muscle. So see, supraspinatus in the upper impression, middle impression, infraspinatus, and the lower impression, you will find the teres minor muscle. So insertion of the infraspinatus. So this is also insertion. Okay, now I will write I. Insertion of infraspinatus. Again in the lower impression, that is again the insertion of teres minor. Now see, so this is the insertion of this muscle, but origin is somewhere in the scapula. So see, this supraspinatus, the origin in the suprascapular fossa. Infraspinatus, the origin is in the infrascapular fossa. Okay, similarly there is one subscapularis muscle, so that is origin is from the subscapular fossa. Okay, just remember that thing. So teres minor origin you already know. So the origin lies in the dorsal aspect of the lateral border in the upper two-third by the help of two slips, isn't it? So in the scapula we have read the teres minor also. Origin was there, but insertion is in the humerus. Okay. Then let's go for the lesser tubercle. So in the lesser tubercle, so there is again the insertion of the muscle. Insertion of subscapularis or subscapularis muscle. Subscapularis muscle. So this is the lesser tubercle is here. So there is the insertion of the subscapularis. So the origin is of subscapularis muscle, that is in the subscapular fossa. Okay, just remember. So supraspinatus muscle origin in the supraspinous fossa. Infraspinatus in the infraspinous fossa origin. Subscapularis origin in the subscapular fossa. Now insertion will be in the C. In the greater tubercle, so supraspinatus in the upper impression, infraspinatus in the middle impression, and the lesser tubercle, there is the insertion of the subscapularis. Okay, are you getting? So these all are the insertion here. Now let's go for the now bicipital group. So now what are the parts in the bicipital group? So in the bicipital group, so it has got a medial lip, lateral lip, and the floor, isn't it? So medial lip of the bicipital group, lateral lip of the bicipital group, and the floor of the bicipital group. Just I will write floor here. So these are the three parts. Now see in the medial lip, you will see the insertion of the teres major. Just in bracket, I will write I. I means insertion, okay? For origin, I will write O. In the lateral lip, there is the insertion of pectoralis major. Pectoralis major. So that is the origin. For origin, sorry, insertion. For insertion, I will write I. Okay, now see, in the floor, there is the insertion of latissimus dorsi. So this is again the insertion. Okay, are you getting? So bicipital group, you know. So that is the group in between the two tubercles, isn't it? So that group, that sulcus, that is the intertubercular sulcus or bicipital group. So same thing. So lateral lip of the bicipital group, medial lip of the bicipital group, and the in between that is the floor. So in the lateral lip there is the insertion of pectoralis major. In the medial lip there is the insertion of the teres major. In the floor there is the insertion of latissimus dorsi. So to remember this thing, so there is one formula like so: lady between two major. Okay. So lady between two major. So lady that is the latissimus dorsi. Two major means pectoralis major and the teres major. Okay, to remember this. So lady between two major. Just you can remember like that. Okay. Are you there? So next see here. So now we'll see the deltoid tuberosity. So in the deltoid tuberosity, again there is the insertion of the deltoid muscle. So deltoid muscle is inserted here. So I means insertion, okay? Are you getting? So that is the insertion of the deltoid muscle. So these are the muscle inserting in the humerus. So too easy to remember that mostly in the upper end there is the insertion. Okay, in the shaft and the lower end, okay, mostly there is the origin of the muscles in case of humerus. Up to here, any confusion? So even in see now, so this head it forms the shoulder joint, isn't it? So now there is the attachment of the joint capsule in the upper end also. Just you can write. So the capsule of the shoulder joint. Okay. Okay, up to here. Insertion okay. Now we'll see the other muscles. See this red color muscle. Now they all are the origin here. Okay. Now we'll see the muscle. They have got an origin in the humerus. Okay. Now let's go further. Now let's go further. Anterior lateral and the anterior medial surface. Okay. Now if you see here, so can you see one muscle here? Can you see this muscle here? So this muscle is the brachialis actually. So now see here. So your anterior border is from here. So this is your anterior border. Okay. So this is the anterior border of the humerus. Now see. So this is the anterior. This is the anterior medial surface and this is the anterior lateral surface, isn't it? So now see this muscle is attached on the shaft on the both surface. So now see here. So the brachialis. So it is attached on the lower 1/3 of the, lower half of the anterior lateral and the anterior medial surface. In both surface it is there. So now brachialis muscle. So this brachialis muscle, it has got a origin, okay, originated from the lower half of the anterior medial and anterior lateral surface of shaft. Are you getting this thing? So this is the anterior.
Yes, sir.
So see this surface and this surface. So this is the anterior medial and the anterior lateral surface. So this muscle has got a origin from the both surface. So now brachialis, directly you can write brachialis. So originated from the lower half of the anterior medial and the anterior lateral surface. Okay. Now, we'll go for the supracondylar ridge. So this is the supracondylar ridge only. Okay. So we have got two supracondylar ridges, isn't it? So medial and the lateral supracondylar ridge. So let's go for the lateral. Okay. Lateral. And we have got a next also. Ridge. Okay. Now let's see here. Now what are the muscles in this? So so this is the medial supracondylar ridge, isn't it? And next one, this is the lateral supracondylar ridge, isn't it? Now, if you see here, so let's go for the lateral first. Now see, this is the lateral supracondylar ridge. Can you see this muscle here? Can you see this muscle here? 1, 2, 3, isn't it? So this muscle is in the lateral epicondyle actually. Let's see for these two muscles. Okay, so these two muscles, can you see here? So these muscles, they have got a origin from the lateral supracondylar ridge, isn't it? So now see, so lateral supracondylar ridge, again it is divided into two. So upper 2/3, so from the upper 2/3 there is the origin of brachioradialis. Brachioradialis. Now from the lower 1/3 of the supracondylar ridge, there is the origin of extensor carpi radialis longus. Extensor carpi radialis longus. Can you see this muscle? So this muscle, that is the brachioradialis.
Yes, sir.
Okay, so most of the upper 2/3 of the supracondylar ridge, that is the upper 2/3 of the lateral supracondylar ridge. So now lower 1/3, there is one more muscle is there. So this is the origin of the extensor carpi radialis longus. Are you getting? So this muscle is the extensor carpi radialis longus, and this muscle is the brachioradialis. So the brachioradialis. Now, if you in exam, if they ask the origin of the brachioradialis, like that you have to write. So the origin is from the upper 2/3 of the lateral supracondylar ridge of the humerus, that is brachioradialis. Similarly, so lower 1/3 of the lateral supracondylar ridge of the humerus, there is the origin of the extensor carpi radialis longus. Okay. So here in this side, you can see here. Can you see this here? So see, this is the brachioradialis and this is the extensor carpi radialis longus. So same muscle. Okay. Two view is there. So this is the anterior view. This is the posterior view of the humerus. Okay. Now I am explaining this muscle, that is the anteriorly you will see the brachialis muscle, but posteriorly you will see the triceps muscle. Okay. So this is the anterior. So anterior view you are seeing from the anterior side, and next view is from the posterior side. Okay. So now this is your medial epicondyle. Here is your medial epicondyle. Okay. So this is the olecranon fossa. So here is the radial fossa and the trochlear fossa is here. Okay. Okay. Coronoid fossa is here. So in the medial supracondylar ridge, can you see the muscles in the medial supracondylar ridge? So this is the muscle. Okay. So in the medial supracondylar ridge, you will see only one muscle, that is the pronator teres. Okay. So the pronator teres, it has got origin from the So just in bracket I will write the origin. So the pronator teres is going to origin from the medial supracondylar ridge. Okay, almost lower part of the medial supracondylar ridge. Okay, just remember this thing. Up to here, okay? Any confusion is there? Any confusion is there? No confusion. Now we'll go for the muscle attachment in the other part. Now you know the medial epicondyle and the lateral epicondyle, isn't it? Now we'll see the muscles in the medial epicondyle and the lateral epicondyle. Now lateral. So now see here in the middle epicondyle. So this is the middle epicondyle. So now see towards the small finger. Okay, this is middle epicondyle laterally. So in the middle epicondyle, see, can you see my 5 finger here? The muscles are like this. So they have got a common origin here. From the origin from the same point, but 5 muscles are there here. See, okay, so these are the muscles of common flexor origin. Okay, so in the middle epicondyle, so there is the origin of the common flexor muscles. Okay, so common flexor origin. Similarly, in the lateral epicondyle, there is the common extensor origin. Okay, but see here in the middle epicondyle, okay, so there is the common flexor origin is there. Okay, in the lateral epicondyle, common extensor origin is there. Okay, in the anterior aspect, but in the posterior aspect, you will see one more muscle, that is the anconeus. So these muscles, so see they are all are the origin only. So just in bracket I will write, oh, that is the origin. So common extensor origin. Okay, now what are the muscles? Okay, having the common extensor origin, I will tell the name now. So common extensor origin is going to take the origin from the lateral epicondyle. Okay, in the anterior side. Okay, so this is the anterior side. Now posteriorly, in the lateral epicondyle, you will see the anconeus also. Anconeus in the posterior. Posteriorly in the lateral epicondyle only. Common extensor origin in the lateral epicondyle. Okay, anteriorly. Okay, most of the anterior or lateral epicondyle directly you can write. Then the middle epicondyle, there is the origin of the common flexor origin or the common flexor muscle. So now the muscles having got a common origin. So now I will give the name of these muscles. Okay, now see 5 muscles are there. So out of 5, see pronator teres, okay, it has got a origin from here also and some part from the here also. Okay, so that is gone. Okay, now next muscle, see here. So the common flexor origin. So pronator teres is there. Okay. Then see, so pronator teres. So now 5, see my 5 finger. So suppose this is the common origin, common site of origin, and they are the 5 muscles. So this is the pronator teres. So this is the flexor carpi radialis, and this is the palmaris longus. This is the flexor digitorum superficialis, and this is the flexor carpi ulnaris. Now I'll give the name. So the pronator teres, then the flexor. So common flexor origin means muscles, they have got a name flexor. Okay. So flexor carpi radialis, palmaris longus, then the flexor digitorum superficialis. So now I am giving the name of the common flexor origin. Okay, so flexor digitorum, then the flexor carpi ulnaris. So now these are the muscles having the common site of origin. Okay, this side. Okay, from this side, these muscles take the origin. So these are the muscles. So just you remember your 5 finger of your hand. Okay, now see here. Let me show you. So this is your hand. So now see, common flexor origin is from the middle epicondyle, isn't it? So here is your thumb. So that is on the lateral aspect. Okay, now see, this is the middle epicondyle. Just you put your hand like this. Now see your 5 finger here. Okay. So now see your 5 finger here. So this 5 finger, okay, from thumb to small finger. Now see here, so 5 finger. So pronator teres, flexor carpi radialis. Then this is the palmaris longus, long finger. So the palmaris longus, middle finger is the long. So next is the flexor digitorum superficialis, and this next is the flexor carpi ulnaris. So just remember, these are the muscles of common flexor origin. Are you getting? Now we have got the muscles with a common extensor origin. So extensor origin is from the back, okay, in the extensor compartment of the forearm. Okay. Now see the common extensor origin. Now, if you see the common extensor origin, okay. Now, so they take the origin from the lateral epicondyle, isn't it? So now see here. So what are the name of these muscles? So see this is the brachioradialis. Thus below that is the extensor carpi radialis longus. If longus is there, we need the brevis now. So the muscles with the common extensor origin. So extensor carpi. So extensor means the name of the muscles consists of extensor. Extensor carpi radialis brevis, because longus has got a separate origin. Okay, so this is the extensor carpi radialis longus. This is the brachioradialis. Now in the common extensor origin you will find the extensor carpi radialis brevis. Then the muscles, so extensor digitorum, then the extensor digiti minimi, then the extensor carpi ulnaris. So these are the common extensor origin, the muscles having the common origin in the lateral epicondyle. Are you getting? So
Yes, sir.
just write the name. Okay, so this muscle extensor in the back side, they will be here in the back side. So extensor carpi radialis longus. Okay, along the thumb finger they will run here. Okay, so digitorum. So again, this digitorum it will split into the four tendon and they will insert. Okay, while reading the individual muscles, I will tell. Okay, from where they will split and how they will insert. Okay, now just you remember the name here because we are reading the bone here. Then extensor digiti minimi, that is for the extension of the small finger, digiti minimi. Then the extensor carpi ulnaris along the side of ulna. Okay, it does the extension. Okay, just remember this. Okay, now we'll see the other muscles. Now let's see these muscles. So in the posterior aspect, so you will see the muscles. See here in the posterior surface, one more muscle is there. So here one more muscle is there. So in the posterior aspect, on the posterior surface, you will see some features, isn't it? There is the oblique ridge is there. So in the oblique ridge of posterior surface, then so in the oblique ridge of the posterior surface, you will see the origin of lateral head of the triceps. Triceps. So this is the oblique. This oblique ridge is just lie above the spiral groove of the or the radial groove. You know this thing. So this groove is the radial groove or the spiral groove. Just above this, the oblique ridge is present. Okay, in that there is the origin of the lateral head of the triceps. See, triceps means having three head. So three head are long head, lateral head, and the medial head. So long head is from the scapula. So the infragluteal tubercle of the scapula, long head. So lateral head is from the oblique ridge on the posterior surface of the shaft of the humerus, just above the spiral groove or radial groove. Next is the medial head. So the medial head. So the medial head of triceps, okay, it takes the origin from the originated from the posterior surface. Now see, the middle head of the triceps originated from the posterior surface. Posterior surface below the or spiral or radial groove. So just below. So most of the posterior surface, see, just below the radial groove. Okay, through all the posterior surface, just below the spiral groove. So this is the spiral groove. So this whole thing is the posterior surface only. So just below the spiral groove, along the whole posterior surface, there is the origin of the medial head of the triceps. Just above the spiral groove and along the oblique ridge, there is the origin of the lateral head of the triceps. Just you remember this thing. Okay, so these are the muscles originating from the humerus. Okay, up to here. Now,
Yes, sir.
so now ligaments and the capsule means, see in the ligament and capsule, so you will see the capsule of the shoulder joint in the upper end, you will see the capsule of the elbow joint in the lower end. That you can just give the name. Okay, so uh, so here, see, just I will draw the outline for you here. So here will be the capsule. So that is for the capsule, for the attachment of the capsule of the elbow joint. So here will be the attachment of the capsule of the shoulder joint. Okay, so thus you can give the name for this. Okay, and even you will see the ligament also. So ligament, so here will be the one ligament, so here will be the next ligament. So radial collateral ligament, ulnar collateral ligament. Just you can write the ligament of the elbow joint and ligament of the shoulder joint in the upper part. Just you can write the name. That will be sufficient for you. Okay, this name of the ligament will read while reading the joints. Okay. Now
Okay,
the
sir.
next, the next bone, that is the radius. Okay, so introduction. So this radius, so it is again the long bone of the upper limb. Okay, it's not the longest bone, and so type of bone, this radius, that is the long bone only. So it is the long bone of the upper limb. So you can see in this diagram here highlighted this red color structure, that is the red, that is the radius. So there are two radius in each hand, isn't it? So in the each forearm. So this is the bone of forearm. So location, so it is the lateral bone of the forearm. Okay, in anatomical position, the thumb will lie on the lateral aspect. So along the line of the thumb, the bone that is present, that is the radius. So this is the radius bone. So this is the lateral side. This is the medial side. So lateral bone of the forearm, that is the radius, and the radius is homologous with the tibia of the lower limb. Okay, just you remember this thing. So this is the introduction. So it is the long bone. Okay, this is the long bone of upper limb, and the location, it is the lateral bone of the forearm, that is the location. Now if you see the structure of the radius or the features of the radius, again you can read the features under this heading. So upper end, shaft, and lower end. Now let's see for the upper end. So if you see the upper end, okay, so in the upper end you will see the head, you will see the neck, and you will see the tuberosity. So directly at the radial tuberosity. Okay. So now see here, so this is the head. So this head, that is the actually articular surface. Okay, so head, that is like a disc shape. Okay, so the shape of the head is disc shape. So this disc shape head, it has got a circumference. So that is the periphery of the disc, that is the circumference, isn't it? And it has got the superior surface. Okay, if you take the disc, so suppose, okay, so take this watch. Okay, the head is like this. So it has got a disc shape, isn't it? So suppose this is the head of the radius. Now see, this is the superior surface of the head, and this is the circumference of the, so this margin of the disc. So that is the circumference of the head, isn't it? So the superior surface of the head is also articular, and this circumference of the head, that is also articular. Let me highlight here. So okay, see here, so this is the superior surface, isn't it? So this is the superior surface. This is again articular surface, and this is the margin of the head, that is the circumference of the head. This is also articular surface, and this surface, the head is lined by the hyaline cartilage. Thus you have to remember this thing. Now the superior surface of the, so we are reading the upper end. So head we are reading. So head, say the superior surface of the head, that is also articular. So it articulate with the capitulum of the lower end of the humerus. Okay, whereas the circumference of the head of the radius, it is again articular. So this circumference, it articulate with the ulnar, no, radial notch of ulna. So So this is also articular. So it articulate with notch of ulna bone. So now this forms the the circumference of the head articulate with the ulnar so radial notch of ulna to form the proximal radio-ulnar joint and forms the proximal radio-ulnar joint. And so this circumference, so it is encircled by or encapsulated by the annular ligament. So the annular ligament, so it will bind this circumference with the radial notch of ulna. Okay, so annular ligament is, so in bracket I will write here annular ligament. So annular ligament is there. Okay, so this annular ligament, it binds this circumference of the head of the radius, okay, with the, that is the radial notch of ulna to make the proximal radio-ulnar joint. So this, that is the name of the ligament, that is the annular ligament. Just you remember this thing. So in this, so it is like this. Suppose here is the notch. Can you see me? Am I visible?
Yes, sir.
Okay, suppose this is the notch. Okay, so this is the suppose radial notch of ulna. So suppose this is the head. Okay, so this is the superior surface. This is the periphery. Now it will be here like this, and there is the annular ligament is binding like this. So like this. Can you see here? So annular ligament is encircling the circumference of the head of the radius, isn't it? So my finger is annular ligament. It is like this, so that it can freely rotate within. Okay. So we have got this movement, supination and pronation movement, isn't it? That occurs in this joint only. So in between the radius and the ulna. So the shaft, it has got three borders and the three surface. Radius, the shaft has got a three surface and the three borders. So what are the three borders? The anterior border, so begins from the radial tuberosity up to the styloid process. So the upper part of the anterior border, that is oblique, and the lower part, that is the vertical. So the upper oblique part, that is also known as the anterior oblique line. So in the anterior oblique line, you will find the origin of flexor digitorum superficialis here also. Okay. While reading the muscles, I will tell this thing. So in the, this is the anterior oblique part. So the oblique part of the anterior border, that is the anterior oblique line, and the lower part is the vertical, and it is like crest like. Okay, just remember this thing. So next is the, so anterior border. Next is the medial border. So medial border, this is the sharp border or the interosseous border. Interosseous border. Okay, so there is the attachment of the interosseous membrane in the lower 3/4 part of the medial border. So extend from the radial tuberosity above and below, it forms the posterior margin of the ulnar notch of the radius. Are you getting? Then the next posterior border, that is the mirror image of the anterior border. So the upper part of the posterior border, that is the posterior oblique line. Just you remember this thing. Okay, that thing we have almost already completed, I think. Now see the surfaces. So now your border became map. Now you have got a surface lap, isn't it? Yesterday I have told this like formula like. So now lateral surface, anterior surface, and the posterior surface. Now you can see the, this is the anterior surface. So the anterior surface is in between the anterior border and the medial border. So this is the anterior surface. Now in the anterior surface, you will see the muscles. So that is the flexor pollicis longus muscles is here, you will see here, and even you will see the insertion of the pronator quadratus muscle. Okay, that thing we'll see during the attachment of the muscle. So this is the anterior surface. So anterior surface between the anterior and the medial border, just you remember. Then the lateral surface. So let me draw here border first. So here is your anterior border. Here is your medial border. So now finally it does not form the anterior margin of the ulnar notch, it forms the posterior margin. Then posterior border will be posteriorly. Okay, now see here. So this is the anterior surface. and this surface, this is the lateral surface, and this here, this is the posterior surface. So now see here the lateral surface. So the lateral surface is in between the anterior border and the posterior surface. That is the lateral surface. In between the anterior and the posterior border, that is the lateral surface. And in between the lateral surface. Now next is the posterior surface. Now the posterior surface is in between the medial border and the posterior border. Okay for you? Are you getting? So the lateral surface, so this is the lateral surface in between the anterior border and the posterior border. Anterior surface, this is the anterior surface in between the anterior and the medial border. Next is the posterior surface in between the medial border and the posterior border. So just you remember this thing. Now next, that is the lower end. So the lower end, so it has got a 5 surfaces. In the lower end, you will see the 5 surfaces. So the name of 5 surface: anterior, posterior, medial, and lateral, and also the inferior. So anterior, posterior, medial, lateral, and inferior. Now see, so this is the lower end only. So the lower end is broad end. Okay. So it is helpful during the site determination of the bone. Okay. So if you see the upper end, so upper end is slightly narrow and round, whereas the lower end is the broad end. So this is the now anterior surface of the lower end. So the anterior surface in the lower part, you will find the ridge-like appearance here. So the crest-like. So in this crest only, you can press the radial artery and you can take the pulse of the radial artery. Okay, you are going to press the radial artery against this ridge and you can take the pulse. So the anterior border, so in the lower part you will find the crest-like or ridge-like. Okay. So next is the posterior. Now you can see the posterior border here, sorry, posterior surface here. So this posterior surface, you will find some elevation and some depression. See, you can see the depression, they are the groove, and the elevation, they are the tubercles. So in the posterior surface, you will find the grooves and the elevation. So these grooves, actually these grooves, they are for the tendon, that is for the extensor tendon. Through this groove only the extensor tendon will run. Okay, so the one prominent tubercle in the posterior surface of the lower end, that is the dorsal tubercle of Lister. So the prominent tubercle, okay, that is the dorsal tubercle of Lister. So this is the dorsal, the prominent tubercle on the lower end, on the posterior surface. Next is the medial surface. Okay, in the medial surface, see, you will find the notch. So that notch, the head of the ulna will fit. So that is the ulnar notch of radius. And just above the ulnar notch of the radius, you will find one triangular area also. Okay, just you remember this triangular area just above the ulnar notch. So see this interosseous border, as it come to the lower end, it will split. So one will go behind, one will come in front. So there is the one triangular area is enclosed there. Okay, just above the ulnar notch. Just you remember this thing. Next is the lateral. So the lateral border, see the lateral border, sorry, lateral surface, from the lateral surface, there is the extension of the bony prominence downward. So this prominence, that is the styloid process. Okay, so styloid process. Okay, so there is the extension of the bony process from the lateral surface, which is projecting downward. So this process, that is the styloid process. So styloid process extend downward from the lateral surface of the lower end. Okay. Next is the inferior. So the inferior, this is the inferior surface. So the inferior surface, that is the articular surface. So inferior surface of the lower end of the radius, that is the articular surface. So this inferior surface, it will articulate with the two bone here. Okay, so you will find the two fossa or the two articular parts. So that is the shape of this articular part, that it has got a triangular articular and the laterally triangular fossa or the articular part, and next is the quadrangular. Okay, so you will find the two depression here. So laterally you will find the triangular depression and medially you will find the quadrangular part. So actually this lower articular surface, it forms the wrist joint actually. Okay, it takes part in formation of the wrist joint. Okay, so just I'll write here. So this surface is articular and take part in formation of wrist joint. So in this inferior surface, two area you will find one triangular area laterally and the quadrangular area medially. So the triangular area, so or the triangular part, so it articulate with the scaphoid bone, whereas the quadrangular area part, it articulate with the lunate bone. And triangular area is for scaphoid bone. Okay, are you getting up here? So that is about the lower ring. So anteriorly, that is, you will find the prominent ridge in the lower part. Okay, then the medially you will find the nose, that is the ulnar nose of the radius, where the head of ulna will fit there to forms the inferior radio-ulnar joint. So the ulnar nose of the radius, where the head of ulna fits, okay, or articulate to form the inferior radio ulnar joint, okay, in the middle. So and the along with this ulnar notch, you will find the triangular area just above the notch. Just you remember this thing. In the lateral, so the lateral surface extend downward as a styloid process. Okay. Next, the posterior surface, you will find the grooves and the tubercle. So the most prominent tubercle, okay, that is the dorsal tubercle of the lister. And the grooves, they are for the, along this groove, the extensor tendon will pass. Just you remember this thing. And the inferior surface, that is the articular surface, so it takes part in formation of the wrist joint. Okay, so two bone will articulate with the inferior surface. Laterally, there is a triangular area, so it articulate with the scaphoid bone, and the medial quadrangular area, it articulate with the lunate bone. So this scaphoid lunate bone, they are the carpal bone, that you know already. Are you getting up here? Now,
Yes, sir.
okay, no confusion.
Anterior surface, sir.
Oh, so this is the anterior surface. The anterior surface, see, so the anterior surface in the lower part, it is like ridge-like. So there is a slightly bony elevation you will see. Okay, so along this ridge only, so when you are going to take the pulse of the radial artery, isn't it? So you are going to press the radial artery against that ridge, so you can feel the pulse here. Okay.
Okay, sir.
Now next is the muscle attachment. Okay. So muscle attachment is easy only. So this blue color, that is for the insertion. Okay, the muscle they are inserting, they are in blue color, and the muscle they are taking origin from the radius, they are in red color. Just you remember this thing first. Okay, now let's see this. Which muscle is this? So this is the biceps brachii muscle. Just remember this biceps brachii muscles. So what is the origin of biceps brachii now? That we have already completed. What is the origin? So now see biceps brachii, the insertion here, see, in the radial tuberosity, in the posterior rough part of the radial tuberosity. Just you remember in the radial tuberosity, there is the insertion of the biceps brachii muscle. Okay. Okay. So that is the biceps brachii. So the posterior rough part. So there is the insertion of the biceps brachii muscles. Now you can see one more muscle here. Can you see this blue color muscle? That is the supinator muscle. So this is the supinator muscle. So the supinator muscle, so this is the lateral surface only. In the upper part of the lateral surface, so there is the insertion of the supinator muscle. The supinator muscle, it has got a origin from the ulna. While reading the ulna, you will come to know. So the supinator muscle, so insertion is in the upper part of the lateral surface of shaft of. So you have to write the complete answer like that. So shaft of radius, not shaft of humerus. So that is shaft of radius. So inserted in the upper part of the lateral surface of shaft of radius. So there is the insertion of the supinator muscle. Okay. So this is the supinator muscle. Now you will find the one more muscle, that is the pronator teres. Now see this pronator teres, so it is inserted along the lateral surface only, but the middle 1/3 of the lateral surface of the shaft of the radius. That is the complete answer. So pronator teres, so middle 1/3 of the lateral surface of the shaft of the radius. So this is the pronator teres. Just you have to remember this thing, okay? So you have read the pronator teres in the common extensor origin also. Common flexor origin also, isn't it? So it has got a origin there. So it has got a origin in the ulna also. That will come. So insertion is here in the middle 1/3 of the lateral surface of the shaft of the radius. So that is the insertion. Okay, just in bracket I will write here. Or directly I will write here. Inserted in. So inserted here. So this is again. So supinator also insertion, pronator teres also insertion, biceps brachii also, that is the insertion. Okay. Now see here. Can you see this red color muscle here? So this is the flexor digitorum superficialis. See, while reading the in the humerus also, there in the common flexor origin there was the flexor digitorum superficialis, isn't it? So here also in the radius also you will find the origin of the flexor digitorum superficialis. So it has got a humero-ulnar head and the radial head. So radial head is from here. So now see here. So the flexor digitorum superficialis. So the radial head. So head from the radial head originated from the. So what is the name of this line? So the upper oblique part of the anterior border is also known as anterior oblique line. So it has got a origin from the upper oblique part of the anterior border of the shaft of radius also you can write, or anterior oblique line of the shaft of radius also you can write. So radial head originated from the anterior line of shaft of radius, or you can write, so upper oblique part of anterior border of shaft of radius also you can write, anything you can write. So this upper oblique part is also known as anterior oblique line in case of anterior border. Similarly, we have got a posterior oblique line also. Okay, up to here?
Okay, sir.
Okay. Now see, can you see this large muscle here? So taking the origin from the anterior surface.
Yes, sir.
Yes. So this is the flexor pollicis longus. So flexor pollicis, so pollex is for thumb. So this muscle is going to help to flex the pollex, thumb. Okay. So now see here, flexor pollicis, so it occupies almost upper 3/4 part of the anterior surface, or you can write the upper 2/3 of the anterior surface. flexor pollicis longus. So just you have to remember this thing, okay? Origin, insertion. Now the flexor pollicis longus. So we have got a flexor pollicis brevis also, okay? Now see, so this is the site of origin of the flexor pollicis longus. Now see it takes the origin, okay? Originated from the anterior surface, okay? That is the upper 2/3 or upper 3/4 also. You can write anything, okay? 2/3 I will write here. Upper 2/3 of the anterior surface of shaft of which bone? Humerus or ulna? See, we are not knowing that also. So we are reading the radius, means from the shaft of radius only. So originated from the upper two-third of the anterior surface of shaft of radius. So this is the flexor pollicis longus muscle. Okay. Now see the next muscle. Can you see this blue color muscle here? This is the insertion now. This is the insertion of the pronator quadratus muscle. So origin is somewhere in the ulna. Okay. In ulna bone origin is there. So this here is the insertion. So the pronator quadratus. So it is inserted along the lower 1/3 of the anterior surface of the radius and also in the triangular area just above the ulnar notch of the radius. So quadratus. So this is now insertion, not origin. Inserted in the lower 1/4 or anything you can write lower 1/4, okay, of the anterior surface of the shaft of the radius and to the and to the triangular above the radius. So up here, okay. So this is the insertion of the pronator quadratus muscle. So this is the insertion. Now you can see one more muscle here. So brachioradialis. Okay. So where is the origin of brachioradialis? Where is the origin of brachioradialis?
Lateral supracondylar rays.
Yes, upper 2/3 of the lateral supracondylar ridge. So there is the origin. Now see insertion is here. So inserted in the lateral surface of the lower end, okay, at the level of base of the styloid process. So inserted in the at the base of so inserted in the lateral surface of the lower end of the humerus at the level outlet, okay. Level of base of the styloid process of radius. So there is styloid process in ulna also. So you have to write the radius here because we have got the styloid process of ulna also. Are you getting up here? Any confusion? So we are seeing the attachment of the muscles on the radius, isn't it? Now
Sir.
see the remaining two more muscles. So these muscles, so they are the abductor pollicis longus and the extensor pollicis brevis. Okay, now the muscles, now remaining muscles, see. And the next is the extensor. brevis. Extensor pollicis brevis. Now see these muscles, these both muscles, they have got a origin from the posterior surface of the radius. So this is the posterior surface. So this is the posterior surface. So from this posterior surface, in the upper part of the posterior surface, there is the origin of the abductor pollicis longus, and the lower part there is the origin of extensor pollicis brevis. So these muscles, so okay, have origin from the, so this is from the upper part of the surface of the radius, and this is just below that. So lower P part, okay, posterior surface of the below the origin of, that is abductor pollicis longus. Now see here, so these two muscles, so they have got a origin from the posterior surface, okay, one above and one below, okay. So these are the muscles, okay, they have got an attachment on the radius. Then the other structure, other ligament, okay, you will find here, that is the quadrate ligament. Now ligament you will find here, that is the quadrate ligament, oblique cord. Then you will find the capsula, and intra-articular cartilage of wrist joint. Intra-articular cartilage of wrist joint. So this thing you will find here. So this quadrate ligament so attached to the neck of the radius, the oblique cord along the radial tuberosity. So the capsule of the wrist joint along the articular margin of the lower end of the radius, and intra-articular cartilage along the middle margin of the that is the inferior margin of the ulnar notch of the radius actually. Okay, so you remember the name of this muscle. Sorry, this ligament and the capsule. Okay, these are the ligament and the capsule. They have got attachment on the radius. So quadrate ligament at the neck, oblique cord at the radial tuberosity, capsule of the wrist joint along the articular margin. Okay, along the margin of the articular surface of the lower end of the radius. Then intra-articular cartilage along the inferior margin of the ulnar notch of the radius. Just you remember this thing. So these are the attachment on the radius. Okay, up to here.
Sir.
So now see, we are reading the ulna bone. Okay. So this ulna bone. So this is the long bone of upper limb, that you already know this thing. So long bone of upper limb, and so the location. So it forms the, okay, it lies on the forearm. So this in the forearm you will find the two bones, that is the radius and the ulna. So the ulna occupies the medial portion in the forearm. So it is the medial bone of the forearm, and it is homologous to the fibula of lower limb. Just you have to remember this thing. So now we'll see the features of this bone: upper end, shaft, and lower end. Let's go for the upper end first. So in the upper end, see the various structure you will see, the olecranon process you will see, coronoid process you will see. Okay. Olecranon process you will see. Then you will see the coronoid process. Okay, mainly process, these two process you will see, and you will find the two nodes, radial notch and the trochlear notch also actually. So that thing I will explain after this. Now see, if you see the olecranon process, so it is like extension, so upward extension of the from the upper end of the ulna. See how, so this the extension from the upper end, so upward extension from the upper end, so that is the olecranon process only. So you can see here, so this is the anterior view is here. So this is the anterior view. Okay, and this one is the posterior view. So you can see, so this is the olecranon process only. Now see here, in the olecranon process, so you will find the 5 surfaces. Okay, the name of surface, and if any particular feature is there in this surface, you have to know. So superior surface, anterior surface, anterior surface. Then you will find the medial surface, and lateral surface. Medial surface, lateral surface, and posterior also. So these are the surfaces in the olecranon process. Now in the coronoid process also you will find the surfaces. So the surfaces, they are the, see, anterior surface, medial surface, lateral surface, and superior surface. Okay. Now let's see the olecranon process first. Now see, so this is the olecranon process. So that is the upward extension from the upper end. Okay, so it's like the hook-like extension. Okay, so now see, here is the superior surface, here is the posterior surface, here is the anterior surface, medial surface, and the lateral surface, if you consider this thing. Now see here, so the posterior surface, if you see the posterior surface of the olecranon process, so it's like triangular in shape. Okay, so the apex of the this posterior surface, so it is directed downward, and the apex, it continue with this border, that is the posterior border of the shaft of the ulna. So here, so let me draw the posterior surface here for you. Okay, so this is a see here, so this is the superior surface. So see this part, so here, so this is the superior surface. Okay, now this part here, so this is the posterior surface. So it's like triangular in shape. Okay, so this is the posterior surface. So this posterior surface is subcutaneous surface. You can feel this part here. So you can feel this part here. Okay, now see here, so the apex of this posterior surface, so it continue with the posterior border. So this is the posterior border of the shaft, that thing I was telling. Okay, now see the next surface, though. This is the next surface. So next surface is this. So this is the next surface, and next surface in this side. Okay, it is not visible here. So one is the lateral surface and one is the medial surface. Just you remember this thing. So superior surface, posterior surface, lateral surface, medial surface. And next is the anterior surface. Now anterior surface is visible here, so it is the articular surface. Then the anterior surface, it forms the upper part of the trochlear notch. So this whole thing is the trochlear notch only. So trochlear notch is formed by the anterior surface of the olecranon process and the superior surface of coronoid process. That coronoid process I'll tell, and then I'll tell about the trochlear notch. So this is about the anterior surface. So the anterior surface of the olecranon process bears the trochlear notch, and it okay. So this part so forms the superior part of the trochlear notch. So actually this trochlea, it articulate with the trochlea of the lower end of the humerus to forms the humeral joint. That is the elbow joint only. Now see here, let me show you here if it is there. So can you see here? So see, this is the trochlea. Now see, this is the coronoid process. So the superior surface of the coronoid process also. Okay, now can you see this part here? So it is more clear here. So now see the ulna bone here. So this is the ulna. So this is the olecranon process. This is the hook-like extension at the upper end. So this is the olecranon process. So this is the anterior surface of the olecranon process that forms the part of trochlear notch. Now next is the here. So this is the coronoid process, and the superior surface of the coronoid process forms the inferior part of the trochlear notch. Now this whole notch is the trochlear notch. So this whole notch, so it articulate. So here it is very clear here. So see, this is the part of trochlear notch. This is the part of trochlear notch formed by the coronoid process. This is the trochlear notch formed by the olecranon process. Okay. If articulation is given here, I'll show you. So here you can see the articulation here. See the olecranon process here. So this is the trochlea of the humerus, lower end of the humerus. Here you can see the trochlea. See now hook-like. So it articulate with the trochlear notch of the lower end of the humerus. So this is the capitulum is here. So capitulum articulate with the superior surface of the head of the radius, whereas the trochlear notch articulate with the trochlea of the ulna. Just you have to know this thing. Now let's go for the next coronoid process. Now the coronoid process, so the surfaces, so superior surface, anterior surface, okay, lateral surface and the medial surface. So these are the surfaces. So coronoid, so this is from the posterior view, this is the anterior view. Now if you see the anterior surface, see in the anterior surface, so you will find the, so anterior surface, see it is the rough. You can see this rough, isn't it? So in this anterior surface, the next feature you will see that is the ulnar tuberosity also. So this is the ulnar tuberosity. So that is the anterior surface of the coronoid process. Let me write here. So next part in the upper end, that is the coronoid process. So the coronoid process, it has got a anterior surface. Next is the lateral surface. Next is the medial surface, and next is the superior surface. No, so the anterior surface, that is the rough surface. Okay, in the lateral side of the anterior surface, okay, so you will find the ulnar tuberosity. So you will find the ulnar tuberosity. So rough, this is the rough part, and you will find the, here you will find the ulnar tuberosity. Ulnar tuberosity. Now next is the lateral surface. Now see here, you can see the lateral surface here. In the lateral surface, especially you will find the two things here actually, that is the radial notch of this radial notch. See here, so this radial notch, so can you see this radius, head of the radius? So this is the superior surface of the head, and this is the circumference of the head. So this radial notch of ulna, so it articulate with this circumference. This will articulate here and bind together by the annular ligament to form the proximal radio-ulnar joint. Just you remember this thing. And below in the lateral surface only, you will find the nose that accommodate this depression, that accommodate the radial tuberosity. And the posterior boundary of this depression, so that is formed by the supinator crest. Can you see this crest like structure here? So that is the supinator crest. Okay. Okay, radial, you will find the radial notch here. Radial notch of ulna, you will see here that notch, it will accommodate the circumference of the head of the radius to form the proximal radio-ulnar joint. Okay, and it is bind together by the annular ligament. Then the annular ligament, it is attached along the margin of this notch. See, this is the margin, anterior margin, posterior margin. Now let me draw the annular ligament here. So this your annular ligament will be like this. So from extending between the, like this. Now here will be the inside, will be the head. So this annular ligament, it binds the head of the this circumference. So here will be the radius will be here. Okay, in this notch also like this. So here will be the radius bone will be here. So that forms, and here is the radial tuberosity. So to accommodate the radial tuberosity, you will find the depression. So so this green color, so this is the radius bone. So this red color, that is the annular ligament. Okay, so this is the radial tuberosity. This radial tuberosity, for this, to accommodate the radial tuberosity, you will find the depression in the lateral surface. So that depression accommodate the radial tuberosity, and the posterior boundary of this depression, okay, which accommodates the radial tuberosity. So that posterior boundary, that is the supinator crest. Just you remember this thing. So supinator crest. You will see the radial notch. You will see the depression, okay, or impression to accommodate the radial tuberosity, and you will also find the. So just you have to remember this thing, okay? The supinator crest. So while reading the muscle attachment, there is the attachment of one muscle. So from the supinator crest, okay, supinator muscle will arise from the supinator crest, and just below there is this depression is here, and also from here there is the origin of the supinator muscles. Okay, while reading the muscle attachment, it is useful. So just remember. Now in the lateral surface, you will see this thing. So radial notch you will see, okay. Then you will see the depression to accommodate the radial tuberosity and the supinator crest. So the sharp posterior margin of this depression and the radial notch. So that is the supinator crest. So you will see in the medial. Similarly, see in the superior surface. Now the superior surface of the coronoid process. Now the next surface, that is the superior. So we have seen the anterior two feature. We will see in the medial, in the lateral you will see these features, radial notch and this supinator crest, and the impression or the depression to accommodate the radial tuberosity. Okay, you will not find any special features in the medial side. Now see the superior surface. In the superior surface, now the superior surface, it is again the articular surface, and it forms the inferior part of trochlear notch. The inferior part of the trochlear notch is formed by the superior surface of the coronoid process. Now let me show you in the nice diagram here. Okay, so you can see here. So this whole thing is the trochlear notch. So trochlear notch is like this. Am I visible to you?
Yes, sir.
Yes,
Yes,
sir.
see, this is the olecranon process is this. So this is the coronoid process. Now see this anterior surface of the olecranon process from the part of the trochlear notch, the superior surface from the part of trochlear notch. So this whole thing is the trochlear notch. Okay, so trochlear notch will fit in the trochlea of the lower end of the humerus. So this surface I am telling. So this is the superior surface of the coronoid process. So it forms the lower part of the trochlear notch. Upper part of the trochlear notch is formed by the anterior surface of the olecranon. So this whole thing, so that forms the hook-like articular surface, that is the trochlear notch. Okay, so you can see here. So this okay. Then the next. Okay, up to here.
Yes, sir.
Now see here. Now the olecranon process also over. Okay, so olecranon process, superior surface, posterior surface, the apex of the posterior surface continue with the posterior border. Similarly, it has got a lateral surface and medial surface. The medial surface, actually the medial surface of the olecranon process continue with the posterior surface. Okay, just you remember this thing. Now we'll go for the next. That is the features in the upper end, remaining features in the upper end. Now see, we have seen the two processes. Now we'll got the two nodes there also. Now these two nodes, that is the trochlear notch and the radial notch. Now how the trochlear notch is formed, you also know this thing, and the other feature you will see here, that is the ulnar tuberosity. So now see, so the trochlear notch, that is formed by the anterior surface of the olecranon process and the superior surface of the coronoid process. Okay, so it accommodates the trochlear notch of the lower end of the humerus to form the elbow joint. Just you have to write that thing. The radial notch. So the radial notch, so it lies along the lateral surface of the coronoid process, and it accommodates the circumference of the head of the radius to make the proximal radio-ulnar joint. Okay, so it is bounded by the annular ligament, and the posterior boundary of this notch along with the impression that accommodate the radial tuberosity, that is crest-like. Okay, and the prominent, so that is the supinator crest. Then the ulnar tuberosity you will find in the anterior surface of the coronate process. Okay, that is the bony prominence, that is the ulnar tuberosity. So that is the features in the upper end. Now we'll go for the shaft. The shaft, say the shaft of the ulna, it has got a 3 borders and the 3 surface as usual. Okay, so now, so you will find the 3 borders, you will find 3 surfaces and the 3 surfaces. So the 3 borders, so the 3 borders, they are the lateral border, anterior border, posterior border, and the 3 surfaces, they are the medial surface, medial surface, anterior surface, and posterior surfaces. Okay, so these are the surfaces. Now let's go for the border first. Okay, so just to remember these things, the border, for to remember the border, just you can write here LAP. So for the surfaces, that is the MAP. Okay, first, just in case of radius, that is just opposite. Map, that is for border, lap, that is for surfaces. Now let's see the border. So the lateral borders, that is the sharp border and the most prominent border, and it is also known as the interosseous border. Okay, because there is the attachment of interosseous membrane. So there is the interosseous border in the radius also. So that is the medial border of the radius is the interosseous border, whereas the lateral border of the ulna is the interosseous border. In the lower 3/4 of the interosseous border, there is the attachment of the interosseous membrane. Okay. So this border is also known as interosseous border. Are you getting up to here? So now this border is
Yes, sir.
okay. So this border, so it extends from the supinator crest. Supinator crest, okay, up to lateral side of head. So that is the interosseous border, and it is the sharp border and the most prominent border. You can feel this border. Okay. So this border you can see here. So this is the radius. Okay. We are not reading the radius. Now we are reading the ulna. So this is the ulna. This is the ulna. So this is radius again. So see in the radius. So this is the medial border. This is the medial border. This is the interosseous border. In case of ulna, this sharp border. So this is the interosseous border. So this is the head of the radius ulna. See here. So head is here, and see. So this prominent border. So you will find this prominent border as sharp border. So that is the interosseous border. And actually there is the attachment of. So there is the extension of membrane between these two borders. So that is the interosseous membrane. So interosseous membrane extend between these two borders. So like this. Okay, it will be near only. They are far here, but it will not be like that. So interosseous membrane will be there. So extending between the interosseous border of these two bone. Now let me show you here. Here is membrane is given, I think, here. Okay, it is given here. So you can see here the membrane. Can you see this membrane? See, so this is the radius. See, so the notch. This is the notch of the. This is the radial notch of ulna. So this is the circumference of the head. So they will fit together to form the proximal radioulnar joint. So see, this is the joint, proximal radioulnar joint. Now see here. So this is the interosseous border of the radius, interosseous border of the ulna. So in between there is the extension of the membrane. So this membrane, that is the interosseous membrane. Okay.
Okay, sir.
Okay. So it extends between the supinator crest to the lateral side of the head of the ulna. So then now the next border, that is the anterior. So the anterior border of the shaft of the ulna, so it extends from the ulnar tuberosity. So extend from the ulnar tuberosity to the styloid process. Medial side. So that is the anterior border. Okay, from the, see, you can see here this border here. So from the ulnar tuberosity, so it runs along this here. So let me draw this border now. So here is the lateral border. So this is the interosseous border is somewhere here. Okay, extending from the, okay, somewhere here, this is the interosseous border. Next is the anterior border. So this border somewhere here. So this is the anterior border, and it extends up to the medial side of the ulnar tuber, styloid process of the ulna. So this is the anterior border. Are you getting up to here? So
Yes,
now
sir.
the next border, that is the, which border? Posterior border. So if you see the posterior border, so it extends from the apex of the, actually this posterior border, that is subcutaneous border only. So you can feel this border here. So just you touch here, you can feel this border. Okay. So while reading the olecranon process, so this olecranon process, it has got a superior surface, posterior surface, isn't it? This posterior surface is like triangular, isn't it? So from the apex of the triangular surface, so there is the beginning of posterior border. Now let me draw here. So you can see this. So you can see here the triangular surface of the olecranon process. Okay, posterior triangular surface. So this surface. Now this posterior border, it begins from the apex of this triangular surface. Okay. Now let me draw with the different color for that border. Okay. Now see, this is the olecranon process, posterior surface. Okay. Now from the apex of the posterior surface, so there is the beginning of the posterior border of ulna, and it finally, okay, terminate at the base of styloid process. So up to here. Okay. So this is the posterior border. So now we have got a interosseous border, anterior border, and the posterior border. These are the border of the shaft of the ulna. Are you getting?
Yes, sir.
Okay. So here the posterior border, that is from the apex of posterior surface of olecranon process to base of styloid process, that is your posterior border. Okay. Now the next, that is the surfaces. So what are the surfaces? Medial surface,
Medial, anterior, posterior.
anterior surface, anterior, and the posterior surface. Okay, the medial surface, anterior surface, and the posterior surfaces. So the three surfaces and the three borders of the shaft. Now if you see the medial surface, so it lies between the anterior and the posterior border. So the medial surface, see, you can see the anterior border here, isn't it? So here is the posterior border is here. So in between these two borders, so somewhere here will be the medial surface, isn't it? So it is just between the anterior and middle, in between the anterior and posterior border. So that is the medial surface. Now next is the anterior surface. So the anterior surface between the anterior border and interosseous border, that is the lateral border, isn't it? And lateral border. Okay. Then the posterior surface, so you will find in between the posterior border and again that is the interosseous border. Interosseous border. So these are the surface. So medial, anterior and posterior surface. So the posterior surface, so here is the medial surface is given here. Okay. So the three border and the three surfaces, you remember that thing. Okay. In between the anterior and posterior, so you'll find the medial. Okay. And between the anterior and the lateral, you'll find the anterior, and in between the posterior and the interosseous, that is the posterior surface. Okay. Okay. So that is about the shaft. And one more thing in the posterior surface actually. So in the posterior surface is divided into two regions, that is the upper and the lower region by the oblique line or oblique ridge. Okay. So the posterior surface, so it is divided into two parts, upper and lower part by the oblique line. And again, the lower part is divided into two regions by the vertical line. By the line. Okay. So into two regions by the vertical line. Just you remember this thing. Okay. So this is about the surfaces.
Posterior surface.
Okay. That is about the posterior surface only. Okay. Thus I am telling now for the posterior surface. Okay. So the posterior surface, so division is there. So there is the oblique line is there and the vertical line. The oblique line divides into posterior surface into upper part and lower part. Then the lower part is again divided into two. Okay, by the vertical line. Just you remember it. Now the next, so we'll go for the lower end. Now see, in the lower end only two features are there. So in the lower end, so you will find the head and the styloid process. Okay, so the head that comes around. See here. So this is the head. So the head, that is the articular surface. Okay, the head, it will fit on the ulnar notch of the radius to form the distal radio-ulnar joint. Okay, whereas the styloid process, it forms the downward extension from the lower end. Okay, that is pointed extension. Can you see this extension here? So this is the styloid process. So you can see this extension. Okay, can you see this extension from the lower end? So this pointed extension. So that is the styloid process of ulna. So similarly, you will see the styloid process of radius also, isn't it? So now we are reading the ulna. So this is the styloid process. This head, it will fit in the ulnar notch of radius in the lower end. So that forms the distal radio-ulnar joint. Proximal radio-ulnar joint is formed by the radial notch of ulna. Okay. This head of ulna, it forms the distal radio-ulnar joint. Let me show you in diagram if it is there. Can you see here? Can you see this diagram here? So this is the head of ulna.
Yes, sir.
Head of ulna is there. So in the lower end of the radius, you will find the ulnar notch, isn't it? So they will articulate to form the distal radio-ulnar joint, or that is the which type of joint? Pivoid joint. Okay, after bone we'll read the joint, then you will got to know. So that is the distal radio-ulnar joint or lower radio-ulnar joint. Okay, superior radio-ulnar joint, inferior radio-ulnar joint, or proximal and distal radio-ulnar joint. Distal radio-ulnar joint and inferior radio-ulnar joint, that is same thing. Okay. Okay then. Now we'll go for the muscle attachment. So it is not big given here. Now we'll see the muscle attachment on the ulna. Okay, now, okay, see here. See, can you see this membrane? So this is the interosseous membrane. Okay, so this is interosseous membrane. Styloid process is here. So this is the distal radioulnar joint. This is the proximal radioulnar joint. Okay, so this two radioulnar joint, proximal and distal radioulnar joint. So this movement, so supination and pronation movement is occurring here. See here. So this is like this position. So supine position is like this. The bone will be like this. Okay, in the next, see, the radius is overlapping, isn't it? So that is the pronation. Supination. In supination, it will be like this. During pronation, so it will be like this. Okay. Then next, now see the muscles here. Okay, see here. So supinator muscle. So the one first muscle, so it has got a origin from the ulna, that is the supinator muscle. So the supinator muscle, so it takes the origin from the supinator crest and the triangular area just be underneath that. So that is the supinator origin. Insertion we have already read. So the insertion is in the lateral surface just above the oblique line, isn't it? Because insertion is in the radius. Okay. Let me write here. So let's go from the supinator. So supinator muscles, now there is the origin, not insertion here. Origin of from the supinator crest and the triangular area and the area underneath it. Okay. And it. Okay. That is actually on the lateral surface. That lies on the lateral surface of the coronary process. Okay, just you remember this thing. Are you getting?
Yes, sir.
Yes, sir.
Are you there or you are not there? So this is the one muscle. Now next is the triceps. We'll go for the triceps also. Let me make it large first. Okay. Now next we'll go for the next muscle. So even see this pronator quadratus. So pronator quadratus also, it is taking origin from the ulna only. Okay. First we'll go complete the muscles in the upper end. Then we'll go for the lower part. Okay. From above downward we'll go. Now let's see the other muscles first. So even the triceps, there is an insertion of the triceps in the posterior aspect of the now see here, posterior aspect of the superior surface of the olecranon process. Now the next muscle, that is the triceps. See here, so this is the olecranon process only, and this is the superior surface of the olecranon process, and this is the posterior surface of the olecranon process. Okay. Now see, in the superior surface, in the posterior part, there is the insertion of the triceps. So next muscle attached on the ulna, that is the triceps brachii, or biceps brachii is bicep muscle. Triceps brachii, that is triceps. So now this is the insertion on the posterior part of superior, just you write in full form, superior surface of olecranon process. Okay, so that is the triceps brachii muscle. Okay, now see here, you can see the supinator here. So this is the supinator only. Okay, along the supinator crest also, and the area underneath that, along the lateral surface of the coronoid process. So if nice picture is there. Okay, let me see. Okay, see here. Now see here, this is the supinator is here. So this muscle, okay, initially I have told about this. So we are reading the muscle attachment, isn't it? So next muscle, so that is the, let's go for the brachialis now. So the brachialis, so origin is in the humerus. Now insertion is here. So brachialis muscle, see, so insertion you can see here. So in the anterior surface of the coronoid process and the ulnar tuberosity. So that is the insertion. So brachialis insertion. Insertion, okay, at the anterior surface of coronoid and ulnar tuberosity. So that is the insertion of the brachialis. Now see even, so you will see the muscles on the medial surface of the coronoid process. So here is the ulnar head of the pronator teres is there, you can see here, and the ulnar head of the, that is the flexor digitorum superficialis. See, this flexor digitorum superficialis, see, it has got a origin from the common flexor tendon also, and it has got a origin in the medial surface of the coronoid process also, and it has got a origin from the oblique line in the radius also. See, this whole thing, that will be the origin. So next we'll go for the pronator teres. So this pronator teres, so this is the ulnar head of pronator teres. So it has got the origin from the common flexor origin also. Okay. So the ulnar head is from the surface of olecranon process. Are you getting? So that is origin. In bracket I will write O, that means origin. Okay. Even so, that is the, there is the origin of flexor digitorum superficialis. So it has got an origin from the same. Flexor digitorum superficialis, that is the next muscle. So this flexor digitorum superficialis also, that is from the medial surface of the olecranon, medial surface of the coronoid process, same. Okay, just you write here. So this flexor digitorum superficialis, it has got origin here also. So that is the anterior oblique line, isn't it? So see, this is, and even this is, and even here also. So there you will find the flexor digitorum superficialis. So muscle take the origin from these all. Okay. Coronoid process. So CP I will write here. So that is the origin of the flexor digitorum superficialis. Now next muscle, can you see this large muscle here? So that is the flexor digitorum profundus. So that means there, profundus means deep. Okay. So this flexor digitorum profundus, it has got a large origin actually. So now see here, it has got an origin from the upper 3/4 of the anterior and the medial surface. Okay. So anterior, from the anterior surface and the medial surface, that's the upper 3/4 of this surface. So origin only, just I'll write here, that is the origin, O for origin. Okay. Now see, origin is from the upper 3/4 of the anterior and the medial surface. Anterior and surface of shaft of ulna. Now it has got again origin is also from here also. So that is actually medial surface of coronoid process and the olecranon process. So medial surface of the coronoid and the olecranon process also. And olecranon process. Even it has got a origin from the posterior border also. So through the posterior border, see, in the posterior border, from the upper 3/4 of the posterior border, so it takes the origin. along with the flexor carpi ulnaris and the extensor carpi ulnaris. Okay, so through one aponeurosis is there. Through that aponeurosis, these three muscles will take the origin from the posterior border. So that is the flexor digitorum profundus, flexor carpi ulnaris, and the extensor carpi ulnaris. Also from the other side right here, posterior from the posterior to the aponeurosis, not from the aponeurosis. So through this aponeurosis, three muscles will arise. So that is the flexor digitorum profundus, flexor carpi ulnaris, and the extensor carpi ulnaris. Just you remember this thing. So along the posterior border also. So flexor digitorum profundus, it takes the origin from the one origin is from here, upper 3/4 of the anterior and the medial surface of the shaft of ulna. Okay, let's write in point. Then the next origin is from the medial surface of the coronary and the olecranon process, and the next origin is from the posterior border. So these 3 points they are the origin from this muscle, for this muscle. Actually, if you read individual muscle, okay, profundus means it also takes the origin from the interosseous membrane also. See, okay, okay. Now up to here, okay. Any confusion? Any confusion?
Yes, sir.
Yes or no?
Yes, sir.
Tell me.
Flexor digitorum profundus.
Confusion is there?
Yes, sir.
And then, okay. This flexor digitorum profundus, so it has got a large origin. Okay. Now see, it has got a origin from the this surface, medial surface of the coronary process and the olecranon process also. It has got a origin from the upper 3/4 of the anterior and the medial surface also, along with the adjoining interosseous membrane actually. Okay, but we are reading ulna, so we are only considering the ulna here. Then it has got a origin from the posterior border also. Are you getting this thing I was telling?
Okay, sir.
Okay. Now the pronator quadratus, see this muscle here. So you can see here this pronator quadratus muscles in the lower part of the shaft. So this pronator quadratus, so it is again the origin because insertion is in the radius. Okay. Originated it is from the lower surface of the shaft. So there is the oblique ridge in the lower part of the anterior surface. Anterior surface of lower part. So that takes the origin from here. Okay.
Okay, sir.
Now other muscles, see up here. Okay. So this is the anterior view only. Now let's go for the posterior view, then it will be more clear. So from the anterior side, we can see these muscles. Now in the posterior part, let's see for the posterior also. So now you will see the flexor carpi. Now see here. So along the posterior border, see, can you see this muscle here? So this is the flexor carpi ulnaris muscle. Okay, even you will see the extensor carpi ulnaris also. Now see, if you see the flexor carpi ulnaris muscle, so it has got a origin from the posterior border plus the medial surface of the olecranon process also. Okay. So the next muscle, so that is the flexor carpi ulnaris. Now see here, we are reading the muscle attachment on the ulna. Okay, some of the muscle we have already completed. See here the flexor digitorum profundus muscle, next muscle. So this flexor digitorum profundus, see, can you see this muscle here with this red color? So this is that is the origin of flexor digitorum profundus. Okay, so it is along the anterior and the medial surface. So upper 2/3 of the anterior and the medial surface of the shaft of ulna. Plus it has got a origin from the medial surface of the olecranon process also. Okay. And it also has got a origin from the posterior border. through the aponeurosis. Okay, that is the flexor digitorum profundus. So this whole muscle, so that is the flexor digitorum profundus. So in the anterior surface, see here there is the next muscle, that is the pronator quadratus muscle. There is an oblique line. So through that there is the origin of pronator quadratus muscle from the anterior surface of shaft of ulna. Okay. Now see the next muscle here. So this is the pronator teres and this is the flexor digitorum superficialis. So these two muscles, so they have got a origin from the middle surface of the coronoid process. Okay, this is the coronoid process only. So this is the medial surface. So this is the anterior surface, where in the anterior surface you will see the insertion of the brachialis. Okay, so brachialis inserts into the anterior surface and the ulnar tuberosity of the coronoid process. Okay, so this is the flexor digitorum superficialis and that is the pronator teres, that is the ulnar head of pronator teres. This is the humero-ulnar head of the flexor digitorum superficialis, because flexor digitorum superficialis, see, it has got a origin from the common flexor tendon, that is the common flexor origin, that is from the middle epicondyle. Okay, from here also, and from here also, that is the anterior oblique line of the radius also. So that is the origin of, so from here to here there is the origin of flexor digitorum superficialis. Now see here in the next side, in the back side, a posterior view. In the posterior view, you can see here some muscles here. Now see here. So you can see one muscle. So along the see here, see along the middle surface of the olecranon process and along the posterior border. Can you see this muscle here? So this muscle, that is the flexor carpi ulnaris. So the flexor carpi ulnaris, see it has got an origin from the middle surface of the olecranon process and along the posterior border of the shaft of the ulna. So it has got an origin from this part. So this is the flexor carpi ulnaris. Okay. Now next muscle is there is the extensor carpi ulnaris. So it takes the origin from the posterior border of the shaft of ulna. So this extensor carpi ulnaris, it has got an origin from the common extensor also. Okay, and from here also. So just you remember, from the posterior border there are the origin of three muscles. So that is the flexor digitorum profundus, then the flexor carpi ulnaris, and also the extensor carpi ulnaris. So it took the origin from this posterior border. Now see these three muscles along the posterior surface. So these three muscles. So from above downward, see that is the abductor pollicis longus. So the function of this muscle is to abduct the pollex thumb. And the next muscle, that is the extensor this is the extensor pollicis longus muscle. That is the extension of the thumb. It's going for is the action of this muscle. That is the extensor pollicis longus muscle. Next is the extensor indicis. So extension of the index finger. Okay. So that is the function of this muscle. So these three muscles, so they have got an origin from the posterior surface. Actually, lateral aspect of the posterior surface. Okay. Mostly up in the upper part of this surface. So there is the extensor carpi. Sorry, there is the origin of abductor pollicis longus. Just below is the extensor pollicis longus, and just below there is the extensor indicis muscles. So these are the three muscles on the lateral aspect of the posterior surface from above downward in the shaft of ulna. Okay. Now anconeus muscles you can see here. So this anconeus muscle. So this is the insertion of these muscles only. Okay. So insertion along the lateral surface here, and the insertion also so extend up to the posterior upper part of the posterior surface of the shaft also. This is the anconeus muscle. Just you remember this thing. Now